You're watching CTOM TV. Knowledge is power.
Hi, Alex. I've was diagnosed in March of 2019 with an intermediate prostate adenocarcinoma, and then went with an ultrasound on March 29th. I guess prior to that, a PSA of 12.1. Then urine chemistry, cytoscopy, biopsy in June of 19. The tumor was primarily in the left lobe with a Gleason score of 7 out of 10, 4+3. And then nuclear bone scan in July of 2019, no evidence of active bone metastasis. Okay. Things showed up like left wrist degenerative change and spinal scoliosis. So two separate urologists wanted to remove the prostate, seminal vessels, and surrounding lymph nodes.
Okay.
In September 16th, 2019, I had a prostate with contrast.
Okay.
And the seminal vessels, normal, lymphadenectomy, none. Okay. Based on size criteria, prostate gland 5 by 3.3 by 5.1 centimeters, 43.8 cc's. PSA density was 0.28 based on a PSA 12.1, but by August the 16th, my PSA was 7.5, and I calculated the density as 0.17 based on 7.5. And then saw a radiation oncologist in November of 19. He wanted to irradiate the prostate. Mm-hmm. The bright light was for me, and maybe not since listening to you, maybe it's not such a bright light, that he gave me options to include active surveillance.
Right.
And that's what I chose, active surveillance. And I've worked with, I'm still working with one, but I've worked with two other naturopathic oncologists. The middle one retired from Victoria, and he was treating me with remedies, nutraceuticals, and different remedies that he you probably know who I'm talking about. He's written the book on it. He's been in it for years, but he's just retired last October. And so my PSA this last month on the 26th of August, it was up a bit. It was up to 8.2. But if I look over the last 18 months, 5 of those months were in the 5 range, and 4 months were at flat 6. So that gives me, over an 18-month period, maybe you can't do it, but I just worked an average of 6.22, but I don't know if that means anything or not.
Yeah, I don't really like to go with just PSA. I think it's really important to get a PSMA scan, regardless of who you are and what stage you're at. If you have prostate cancer, get that full body PSMA scan. It's not worth missing something.
And actually, the oncologist who just recently retired out of North Van, that's what he had suggested. But I don't know if it's available in Vancouver.
It is. Yet. Yeah, it's available at Initio and Burnaby.
Initio, okay. Yeah, that's who he had mentioned. But since he was retiring, I saw him in I last saw him in July, I guess, and it was an 8-minute visit. He wasn't invested, he was already retired, basically.
Yeah, I know.
So the comparison MRI I have, the first one was done September 19. The next one was done November 2020, and the prostate at that point was down to 39 cc's. On the 2019 one, there was a 1.8 cc PIRADS 4 lesion in the left base and the midland peripheral zone.
Okay. And
a 0.2 cc PIRADS 3 lesion in the left midland and anterior zone. Now in 2020, a 0.1 cc lesion in the peripheral zone on the right side, which was new since the last study. The PIRADS, the one in the left midland, was at this point only 1 cc's, but it's PIRADS 5, whereas it was
Okay. So
it was
I think
PIRADS 4.
we're seeing a bit of a theme that the watch and wait is not working.
Is that right?
That's what it sounds like to me. If you're getting new sites.
Well, the one disappeared. There was a new one, a 0.1 cc on the right side, but the lesion described in 2019 in the left midline and anterior zone on September 16th, 2019 examination is not seen with any certainty in November 12, 20.
What type of scan was it?
MRI.
MRI.
Okay. Okay. So did they say anything in the MRI about positioning and body positioning and whether it could have just been, sometimes these sort of things happen with MRIs?
It was done at the same facility. In the
Okay.
big picture, I'm not really happy with that facility, like Falls Creek, because it took me months to get a comparison out of them, and it was just really difficult. But
I would really I'd go for the PSMA PET. Why mess around?
Yeah.
It's just
So
not worth it.
again, I've been forwarded on Dr. Youssef, and I have a consult with him next month.
You can just get a PSMA PET. You can download the form off the website from Initio, and then just go to a GP or a drop-in and just say, here, sign this. Sometimes as a form. You can do online doctors. They got online doctors.
It's easier than that, actually. It's just Alex is so in the lab, he might forget that we actually provide this as a service for people. So we can certainly help coordinate this for you and make sure the referral gets signed and you get your scan. PSMA scans are usually within 2 to 3 weeks, assuming all machines are firing on all thrusters, and it doesn't take that long to get a scan happening for you.
Okay.
So that would be one way. And they, I'll just leave it at that. So if you want our help, you can let me know, Jeffrey, with that. But I guess what Alex and I are both hearing and a bit concerned about is, while of course it's right for you to be feeling some hope and some positivity about the fact that one lesion seems to be smaller, not quite as present, not quite as defined. The fact that there are new ones is what we're worried about for you.
And I just think that the imaging modalities are not that great. As we went over the statistics early, PSMA PET is 92%.
Yeah.
It's still going to have 8% false. It's going to miss 8% of those tumors, but hey, that's a lot better than the other imaging modalities. So, I mean, use the best you can.
So when I'm, and again, I did the math, like between 2019 and 2020, those 14 months, it looked to me like there was a 45% reduction in the main tumor because it was 1.8 cc in 2019. And 14 months later, it was only 1 cc. So is that false to look at it that way?
Well, it's just not that. What we're trying to say is the statistics show it's just not that accurate. So if we could say that is 92% accurate, we'd feel a lot better on your behalf. But 2 scans together it takes to get to 65% accurate. So that's the concern.
Yeah. I would start with the PET.
Yeah.
There's no reason not to.
Yeah, the goal. Yeah, it might sound like we have shares at the PET CT clinic. I just
we
don't.
We
don't make any money off the tests we recommend. We're not, while we have affiliations so that we can get our clients in quickly. The benefit is to you of having the most accurate assessment. And if the PSMA scan comes back and it looks good, then you can continue to do this active surveillance.
Exactly.
That's what feels best to you.
Yeah.
Well, the Dr. Klimo did recommend the PSMA, but he didn't make me aware that it was available at that point. But it wasn't
available at that point.
Yeah,
it really is new technology, so it really is.
Yeah.
So it's just been available in Canada about 6 months now.
Well, was available initially at a few different places, and then basically they couldn't get the isotopes, and now they got the isotopes again. So it's happening now again, and there's a lot of confusion around it. But this particular facility, Initio, has gone through a few different ownership changes. And so they just replaced their scanner. And so during the last few months, it wasn't available. And I believe now it is.
So can PSMA PET, can the previous two MRIs I've had, can they be of any use to compare against the PSMA or not?
I would use the PSMA as the baseline.
Yeah.
I would start with that.
Okay. So
Yeah.
anything else that may be relevant? I've had lifelong sleep issues, and
Okay.
I recently learned, probably earlier this year, that I have mycotoxins.
Sorry, you have what?
Mycotoxins.
What are mycotoxins? I'm not aware of those.
I have fungus in my body.
Oh, really?
Yes.
Okay. And is that being treated properly? Now, who discovered this? Was this your naturopath that discovered it?
Yes.
Okay. I would be a little wary of that diagnosis.
In terms of?
Naturopaths are not doctors. I don't.
Well, I did get sent away a test.
Yeah. I would get that confirmed through your GP or a college registered specialist, an MD, not an ND.
Okay. My GP, I don't know if she would even be capable of it.
Yeah, well, you see, the thing is the naturopaths kind of offer tests that can't be confirmed or not confirmed by standard medicine. And that's kind of what they do. So, you can't really dispute them because, there's not really a test for that.
I think we should probably not say anything more on that specifically because it's not something you're familiar with, Alex. Maybe you want to do a little.
I would like to add, though, that I've had the house tested and there is mycotoxins in the house.
Okay. Well, I would really speak to your GP about that. And if they don't want to do anything, get them to send you to an infectious disease specialist because they have the tools of the trade.
Yes. And remember that right now in Canada, not just because of COVID, it was this way before, but it's a little worse now. To see a specialist can take a very long time going through standard channels. And sometimes that's just the way it is and how it has to be. For the most part, there are ways to expedite things depending on who you know and also if you're willing to pay. So any of the things we're talking about, can be accessed more speedily and from numerous different facilities globally, if you're willing to pay. Really, it comes down to that.
Yeah.
So what I'm trying to say to you specifically, Jeffrey, is if you strike out with the GP in terms of this, or the visit to the infectious disease specialist is like 2 years away, don't feel like you have to wait for that. There are options. The other thing I do want to say just to everybody, because there are, it's natural to want to do integrative approach to cancer care, and we support that, just to be clear. There is evidence to certain things that integrative practitioners provide, which is why it is advancing as a school of medicine. But there's lots of things that naturopaths provide that don't have a lot of medical science evidence, peer-reviewed studies, something reproducible, some mechanism that we can say, oh, okay, I understand how this mechanism works and I can see how this would be helpful. If you want to check in about any of these things, a great resource is PubMed, PubMed. Just like published medicine. So PubMed, it's the National Institute of Health website where they post, it's quite recent, quite current information. And so if you just Google PubMed, PubMed, And just keep that in an open window there. And anytime you hear of anything, go there and look there, because what you'll see is the most current, well, you'll see all that they have of the actual studies talking about this particular thing. And all you need to do essentially to get started, at least, is read the abstract and see, does it say this no clinical evidence shown, or warrants further study, shows promise, things like that. If you don't see the thing you're looking for in PubMed, it probably hasn't had any studies done at all of any merit. And so that's kind of a nice little check for you to see, like, where is this in the queue of things that actually have merit, that have been vetted, and that will allow you to have more trust in your next steps.
So would I look up mycotoxins on PubMed?
That's what I would do if I were you. I would look up all of those things that are being recommended to you, and you'll see that some of them almost certainly will be there, and there'll be some support, and others may not be there. And if you can't find it anywhere else, again, a good statistical resource, it's probably something that you want to imagine is at best having a placebo effect for you.
Thank you for watching CTOM TV. Subscribe below and stay informed.